On today's episode of the Original Medicine Podcast, we're going to be talking about what acupuncturists don't know and how they can learn. This is an episode about the complement channels. I want to talk to you about what they are, when they came about, and why we don't learn them in school, and how you can learn them. So if you are an acupuncturist or you are someone who goes to an acupuncturist who is wondering why you have never heard of the stuff that I'm talking about, stay tuned. Please join the conversation, connect with me on Instagram, ask questions, and we can go from there. So let's get into today's episode. So I kind of misspoke in the beginning when I referenced when the complement channels were created, where they came from. The complement channels were always part of Chinese medicine. Really, it's when was traditional Chinese medicine created? And the answer is in the 1950s. People, including acupuncturists, are going around the world saying that TCM is thousands of years old, and this is what has been practiced for thousands of years in China, and this is actually not accurate at all. I don't mean to call anyone a liar, but it's just factually inaccurate. TCM was created after Mao took over China in the Cultural Revolution, so that was not thousands of years ago, that was in the 1950s. So TCM is basically a little cookbook that they created from something called the primary channels. Now I'll get into this in just a second, so bear with me if you're like, what are you talking about? I've never heard about this before. There are points on the primary channels that were put together in little groupings, like a little recipe, that were designed to treat symptoms. And so the reason this came about was because Mao had banned the practice of acupuncture altogether when he took over China. He wanted them to be modern and Western. And so acupuncture, this traditional form of medicine, was not going to fit into his idea of what he wanted China to be. So he banned the practice. But after some time, they realized people are sick and they need more health care than simply allopathic medicine can provide. So what they did was take points from the primary channels, group them together like little recipes, and they trained a bunch of people who were not otherwise trained in medicine or acupuncture, and they sent them out into towns and cities across China. And these people were called the barefoot doctors, which I think is a fascinating story. I genuinely do. But the sad part about what was left behind is that that's the meat, and the complete system of acupuncture is both the primary channels and something that was called the other channels, and that my teacher, Anne Cecil Sturman, has named the complement channels. When she was putting together her landmark text, Advanced Acupuncture, this was the book, the clinical manual in which she cataloged how to practically use these channels, which was just an incredible resource for all of us. She thought, I can't just call them the other channels. They have to have some other name. So she reached out to her colleagues and, who had been studying with her teacher as well, and said, how can we name these in a different way that is going to be more specific than just calling them other? And collectively, she and they came up with this idea for complement channels. And I think it makes beautiful sense because the complement channels act like this fortress, so to speak. They're always protecting the primary channels because the primary channels have access to the organs. Okay, so when the body encounters a challenge of some sort, this could be a virus, a bacteria, an emotion, an injury, whatever the case may be, it has a really elaborate way and a very smart way of taking this problem and putting it somewhere else, because it doesn't want that problem to be held in the primary channels, because the primary channels have direct access to the organs. And so it puts it somewhere else and parks it there until something can be done with it. But sometimes it happens that we don't do anything with it. We don't work it. It doesn't work its way out. And so then maybe later down the line, we develop a problem. Okay. So all of that is called the full system of acupuncture, the complete system of acupuncture, the other channels and the primaries, or the complement channels and the primaries. TCM is none of that. TCM is point prescriptions, again, the little recipes that take points from the primary channels and then use them to help people with symptoms based on their symptoms. So it's like if you came in and you said to me, MG, like my stomach's been killing me every time I eat, and then afterwards I have diarrhea. Okay, so clearly you have gastrointestinal problems. We're going to use spleen 4, spleen 6, spleen 9, stomach 36. We might use kidney 3 to support that. Maybe we'll use a lung point. We'll put in Ren 12 and maybe another stomach point too. Okay, that is chaos, in my opinion. There's nothing at all clear about that because we're using so many different channels. Because what is true about how we all talk about acupuncture is that things in Chinese medicine are all interrelated. Organs support other organs, channels support other channels. It just goes around and around. But then when we use TCM doesn't acknowledge that at all. Like, it's just, I mean, I guess that's not a totally fair statement. It does acknowledge it to some degree, but it's just like cherry picking. Hey, this point is supposed to do this thing, so let's like put it in the body and make sure it, make it do that thing. But then you put another needle in and it gives a different instruction. It's just very chaotic, and it misses the whole point that the body, from a Chinese medicine view, is designed to shuttle away the problem and put it somewhere else. So if we're simply using the primary channels, I don't understand the thought process behind this. And I was really fortunate in school, when I was very young in school, that I had a couple of teachers who did study with Jeffrey Yuen, who is my teacher's teacher, who is an 88th generation Taoist priest, and he holds an oral tradition that has been passed down in his family. And the reason that is so significant is because, as you might imagine, the classical Chinese medicine texts were edited in the Cultural Revolution as well to Mao's liking, and a lot of the information was lost. But it's families like Jeffrey Yuen's who still have the tradition alive, being passed down from from generation to generation, that gives us the rich information that we all really want. And I think that pretty much every acupuncturist, when they go to school, they want this deep information. And I think they're looking for that. But then they get sucked into this vortex, which is memorizing this and like checking this box and doing this thing so that you can pass school and pass boards and get licensed and get out and practice. But then you get out into practice and you're like, wait a minute, like I'm not getting the results for people that I thought that I would be able to. So maybe that means that acupuncture isn't that effective on its own. Maybe I need to become also an herbalist, or I need to double down on supplements, or I need to take a functional medicine class. And then it just keeps expanding. And I think what is happening here is that people are going into other areas of medicine because they are trying to help their patients. So it's coming from a good place and it's done with good intentions, but what it's doing is watering down the practice of Chinese medicine. So instead of going deeper in their study, they're going more broad, and it's actually getting worse because they're not focused on what their training is. So my argument is that what most acupuncturists don't know, and what they would probably love to know, is the complement channels. And I think schools are failing students when they take us under their wing and they school us for literally, in my 4 years, most of us go to school for 4 years. We do learn herbs, and I'm not hating on herbs. I think herbal medicine's amazing. But I think what people come out with is such a fractionated, if that's even a word, view of acupuncture. It's so limited, and they have all these limits in their mind about what they can and cannot treat. And schools teach us that as well. Like, you can't treat this or you can't treat that. You have to refer out for this. Or if somebody has this, they have to have herbs. I would agree that if you're treating with TCM, in many cases, you absolutely do need to have herbs as a partner to that treatment. But I absolutely disagree that that's the case when you're using the complement channels, because you are able to reach where the problem is actually stored in the body. And by doing so, you produce results. The body produces results because you've used the correct channel for that person and for where the pathology is stored in their body. Many well-intentioned acupuncturists, when they're not getting the results that they know in their hearts that they could be for their patients, they're going broader and not deeper, which means they're taking additional certifications, or they're taking like a weekend course in dermatology, or they're taking a weekend course in like Tuina, or there's nothing wrong with any of these trainings, but it's just that you're going more broad than you are going deep. And when you go deep, you can literally treat anything, A to Z. Like, I never, ever once worry that I won't be able to treat what comes in my door. And it's not because I think that I'm the best acupuncturist around. It's not because I'm egotistical. It's because I've had such good training from Anne Cecil Sturman. And I was starting to say earlier that I was really fortunate to have been introduced to this, just like had my interest peaked because I had a couple of teachers early on in my school in California that studied also with Jeffrey, and they would mention this thing or that thing. And then meanwhile, I was getting treated with TCM treatments and I was getting worse and worse. So I was being injured by TCM. What TCM books were telling me should happen in this treatment were not happening, and the opposite was actually happening. And then I was hearing from teachers, hey, there's this other thing. And so about midway through school, LA was becoming a little bit too hectic for me personally. I needed to be in a little bit quieter place. So I decided for personal reasons to transfer to a school in New Mexico where I had lived before. And it was at this time where I was just beginning clinics that I met a supervisor who knew Anne Cecil Sturman and was bringing her out to teach continuing ed classes for the first time outside of New York City. And she told me that I should sign up. And of course, I was worried about, do I not know enough? Will I understand? I had all the doubts and limiting beliefs, but I signed up and my life was forever changed because being trained in this way made me believe in the capacity of acupuncture that I don't think every acupuncturist has. And it's not because they don't want to, it's because they have based their beliefs on what they have seen in clinic. So they've seen improvement and they've absolutely seen people get better, but there have been significant limits to what they can treat. And this not because they don't want to help, it's because they don't have the tools to help. And the reason they don't have the tools to help is because acupuncture school simply does not teach this. Now, there are a couple of schools, actually even in the Southeast, that claim to be classical Chinese medicine schools. But I will tell you from talking to people that have attended these schools that they don't have ample opportunity to practice these channels. They learn sort of about them, but they don't learn them in a way where they could go right into clinic and use them. And I've heard stories about supervision in these schools where the acupuncturist is saying that is a clear example of a supervisor who does not understand what the low channels are. The low channels are the channels that we bleed to release pathology, and they are 1000% indicated for any kind of emotional issue. There is not a single reason that someone should not be bled, really ever. Even people with a bleeding disorder can benefit from a bleeding treatment because bleeding treatments treat the blood. So we would certainly take precautions in someone. I mean, if you had a very extreme bleeding disorder, maybe not. But even people with blood disorders or bleeding disorders, clotting disorders, we would still consider bleeding them. But that's not the case in this patient. We're talking about somebody with a very straightforward, like I have anxiety, I'm having a lot of emotional, like big emotional experiences. That is absolutely the time to bleed someone. And this supervisor is telling them, no, this isn't an appropriate treatment. And the student, having studied outside of school, knew that it was appropriate, but was not being allowed to practice. So this is my argument for where, even though there are schools that call themselves classical Chinese medicine schools, they're not actually teaching good, solid information and giving students a chance to utilize the channels in the school clinic. And so, again, this is just where I come back to, we need to support acupuncturists better, and we need to revamp the curriculum for acupuncture schools, because acupuncture school is not an inexpensive endeavor. It is basically the same cost as going to Western medical school, except for when you get out, there's no job waiting for you. There's no hospital. There are increasing hospital jobs, actually, but you're definitely not going to use the complement channels in hospitals. But generally speaking, you are going to be self-employed. You're going to be building a practice, building your reputation, all of those things. And there is no one to support you through that. And I think if that is going to continue to be the way the practice of acupuncture works, where we're all self-employed business people, I don't think that's wrong, but I think that acupuncture schools need to be even more concerned with what they are teaching, regardless of the actual practice. Everyone needs to be learning true Chinese medicine. And it really, really disappoints me that so many people, myself included, were going to school learning TCM and not actually the full system of acupuncture. Because when you set out on this journey to go to acupuncture school, you do it because you love the idea of treating people in a way that respects all of their life experiences, that treats them like as a whole person, that's looking at those life experiences with the physical health problems they may be having and being able to support them from A to Z. But then you only have TCM tools, and so you find yourself stuck like, how can I continue to help people more? And like I said in the beginning, I think what that leads people to is a broader study. Whereas if they went deeper, then one, we wouldn't have this problem in the first place. But I think if we go deeper and we had acupuncturists who were more deeply trained in the full system of acupuncture, then they would be able to treat anything that comes in their clinic successfully, as opposed to being worried about, somebody called me and asked if I can treat, XYZ Western medical diagnosis. That is the thought process of a person who has heard acupuncture can help with something. So it's totally normal for the public to say, hey, like I have tinnitus, like this ringing in my ears is killing me. Can you treat that? There's absolutely nothing wrong with a layperson calling and asking that. But when an acupuncturist gets into that mindset of thinking, well, have I ever treated tinnitus before? I don't know if I can. That is a really dangerous place to be for an acupuncturist, because if you truly are practicing Chinese medicine, you are doing that from an understanding of Chinese medicine physiology. And you know that the reason someone has ringing in their ears is because that they're under-resourced. And so you know that when they come in, yes, of course, you're going to be able to help them. You're going to listen to what they have to say about their experience. You're going to take their pulse, and then their pulse is going to give you information about where the problem is in their body, which channel is affected. And then from there, you'll know how to treat. And it really concerns me that more acupuncturists don't operate under this way of thinking, because if they had this information in order to think this way, they could do so much more for people than what they already are. And I think that acupuncturists would have so much more confidence. They would elevate their practice. People's results would be better. And then acupuncture as a profession would be elevated, which is always my goal as well. So if you know someone who is interested in learning Chinese medicine, cannot recommend enough Anne Cecil Sturman. There are absolutely other teachers on the scene. I have not studied with most of them. Anne has been my primary teacher, and I think she's far and away the best teacher. Obviously, I'm biased, but from what I hear and what I have seen, there are people who have been studying for a very long time and not getting the concrete details. Whereas, like, I've been in practice, I guess I've been licensed about 10 years now, so I've been practicing about 12. And I feel like I have really good, like, concrete, applicable knowledge. And I want that for everyone. Like, I don't aspire to be a scholar. I don't feel like I need to know everything. What I need to know is enough to take somebody in, listen to what they have to say, feel their pulse, and know what's going on, and then treat them. And other acupuncturists can have that too. So if you are looking for an acupuncturist who does this, I practice remotely as well as in my Greenville, South Carolina office in person. I have people that come in from North Carolina. I have people that come in from Georgia, but I have treated people remotely all around the world. So feel free to reach out. I do have online scheduling via my website. And if you're looking for someone who practices like this and you're looking for an in-person appointment, you can certainly reach out and I can try to connect you wherever you may be. Thank you for listening. And I hope this helped you understand more about how I practice and how it's different from what we learn in school. Of course, everyone is going to practice a little bit differently, but this is a huge chunk of information that is not included in acupuncture education. And I feel that it's a huge lack. It's really a sad thing that schools don't include this. So the more we can talk about it and share about it, the more we can spread the word and get more people to practice this way. Because really, I'm a big believer of a rising tide floats all boats. So thank you for listening.